Healthcare providers are being stretched to their limits. The Affordable Care Act is a wonderful way to provide health insurance, but it has increased the number of patients getting care at a time when COVID has pushed many healthcare providers into retirement. Healthcare providers are also seeing many more patients as the baby boomer generation ages and requires more care. Alternative communication modalities are being developed to offer new ways for patients to communicate their needs and assessment data without inpatient visits. To increase acceptance by patients, however, healthcare providers and their organizations will need to engage with patients to ensure these new communication technologies are seen as viable alternatives. There are three emerging technologies being developed for use as alternatives to inpatient visits. They are virtual reality, the Internet of Things, and artificial intelligence. Virtual reality is computer-generated images and vignettes that simulate reality. Artificial intelligence is the interconnection of computing devices that are embedded in everyday things like watches, household thermostats, or refrigerators, for example. And artificial intelligence is computer programming in which computer systems can decide on a course of action without human input. There are several different ways patients currently interact with their healthcare providers following an inpatient hospitalization. Patients use their mobile phones and their desktop or laptop computers. They use the internet and text messaging. They call from their landlines and also come to inpatient visits. The study by Alexander et al. Indicated some interesting preferences. For example, older individuals were less likely to prefer using technology versus seeing their healthcare provider in person. Patients who felt their symptoms were severe preferred to come to the hospital to be seen rather than use alternative technology to communicate their concerns to their healthcare provider. Finally, the presence of a cardiac symptom positively correlated with preference for inpatient communication versus telephone call. According to Alexander et al., offering multiple technological modalities is best for addressing post-hospital communication. So how should the hospitals and healthcare providers encourage the use of emerging communication technology? Creative solutions will need to be explored to help patients adopt new technologies. Since people learn best in different ways, education needs to be provided in different ways. This means providing instruction in writing, in videos, through infographics, and return demonstrations. Information needs to be presented in different languages also to ensure non-native speakers have access to the information. Hospitals should brainstorm different ways to encourage their patients to learn about new communication technologies. Hospitals can trial awareness campaigns. They can offer incentives to patients or consider waiving a copay when a patient completes an educational program. After any training hospitals provide, they should get feedback to evaluate what was helpful and what wasn't helpful to improve their future training. New communication technologies need to be patient-centered. Interfaces have to be user-friendly and easy to access if patients are going to adopt them. Navigation needs to be understandable and tech support should be available. Virtual reality offers some interesting solutions, not today, but in the future. An interesting solution could be a virtual reality medical clinic. Imagine seeing an avatar of your healthcare provider using your home VR setup. Once logged on, you would enter a clinic room. With the addition of AI technology and the inclusion of IoT devices, this would be a significant leap forward in healthcare from home. The IoT devices would check your vital signs and the avatar would ask questions. With embedded AI, the computer could search your entire medical history and compare it with all known information about disease processes and symptoms faster than any person could. The VR system would be synchronized to the healthcare provider's software, so data would be available seamlessly. The system could also be designed to automatically notify 911 if the patient had an event while in a virtual appointment. Communication can be personalized to each patient's preference. Patients can choose smart devices that offer data capturing potential. Different devices patients might opt to use include things like pulse oximeters or blood glucose monitoring devices. Patients can choose to share the data and allow it to be analyzed by their healthcare provider remotely. The patient's care plan can be personalized by adding specific IoT technology they choose to share data from. Before healthcare entities can roll out new communication technology to patients, healthcare providers need to know how to use it successfully. Healthcare providers will be ambassadors of the new technology and are key to its success. Healthcare providers need access to the technology and be able to navigate it easily. They also need tech support available if they run into any glitches. Privacy and security are baseline components for any new technology. Healthcare providers are required to protect patients' privacy. New technology will need to meet current standards for security. Policies need to be communicated to patients so they can feel safe knowing their data is secure. Patients should also be notified how their data will be used if they are sharing it through a new system. How can safety net populations be best served? Patient populations with limited incomes are more likely to use a mobile device to communicate with their healthcare providers rather than a desktop or laptop computer. Because of this, new technology needs to be fully functional on a mobile device. Older adults may need more time learning new technology. There should be multiple avenues available for them to get help if they struggle with adopting any new technology. New communication technologies offer exciting possibilities for patients and healthcare providers alike. Workloads could decrease as artificial intelligence, virtual reality, and the Internet of Things combine to provide patient care. And patients themselves may see better outcomes along with improved access to healthcare. The path from where we are now to where we could be in 10 years will be interesting and full of learning. Thank you.